I am Dr. Abhishek Kumar Mishra, and again this is about total knee replacement. Now this is about an elderly gentleman who had come all the way from Andaman and Nicobar Islands to get his knees operated. He happens to be a father of one of my dear friend's friend. He is a Keralite, he is a fit, young, 92-year-old, young I should say, gentleman. And he was doing very well till a few years back when he started developing pain in both his knees. And this pain, it has grown in severity and intensity for the last few months to such an extent that walking and all has become quite difficult for him. Now, for a person who is otherwise fit and healthy, if not able to walk, unable to walk due to some reason, rest of his parameters are all right, then that person certainly feels perturbed and wants to walk again. Now, when he was suggested surgery by my friend, who is Dr. Anupraj, there were some questions which were which came to his and his relatives' mind, whether his age is fit for surgery or not, whether his body will be able to take surgery or not. Because you see, knee replacement has got so many myths surrounded. Biggest question in this case was whether at age of 92 or maybe he's 93, he should be operated or not, whether his body would be able to take the surgery or not. We kind of called him, we ran all his investigations. We found out that apart from the knee, which has aged according to his age, the rest of the organs are quite young. And we took him up for surgery. We took a precaution in the sense that we did not do both the knees at the same time. Instead, we did what is known as staggered procedure. We did the first knee, and after 2 days, we did the second knee. And basically, in about a week's time, he was discharged from the hospital. Now that he's back in Andaman, he and his son, they keep informing me that every day he's getting better, his pain is getting better, his swelling is going down. He's able to walk for longer distances, he's able to walk for longer durations. Every day he's getting back to as normal, say 15-20 years back in his life when he was able to walk comfortably and without any pain. He's independent again now. Despite being 93, 92 years old, he's not dependent on his relatives or anybody else in the family for his daily chores. He's able to do everything on his own, very independently, and that's the most important thing I would say about these surgeries. They make the patients pain-free and independent. This is the key word, pain-free and independent. Now probably he is the first person from Andaman and Nicobar to undergo replacement. So I think it's like a double whammy. He has not only his age, probably he would be one of the oldest persons in the world so far to undergo a bilateral knee replacement. And apart from that, probably he would be the first person from Andaman Nicobar Islands to undergo knee replacement. So it's a kind of double distinction for him. Officially, these facts have to be checked, but generally, say if not first, then probably one of the first few from Andaman Nicobar to undergo these surgeries. And if not the oldest, probably one of the oldest guys in the world to undergo a bilateral knee replacement and doing well at that.
I am Dr. Anupraj, Medical Director, Holy Angel Hospital. This is regarding one of our patients, Mr. Sridharan, who is my uncle also. Actually, he is 92-year-old and he lives in Andaman Island. And last 1 month he was so bad that he was not able to stand even. So that time I told him, come over to our hospital, because in our hospital we have been doing such cases very, very regularly. And last time when we had done one of the cases was about 88-year-old lady, and she was quite fat also. And uncle happened to be a very well built and thin. So then I suggested, I thought that it will be a successful surgery. And then with confident, I said, you come over, we'll do something. Then Dr. Abhishek Mishra took over, he's our senior consultant. He took over the case, he examined, and then we took an X-ray, CT scan, and then decided to operate on him.
I am Mr. Sridharan, age 92 running, the resident of Kerala, at present domiciled in Andaman and Nicobar Islands with my family, and I was having this knee problem for the last 10 years, but I was surviving with that. For the last 1 or 2 months, I felt it so serious, and I'm very thankful to the physicians over here, especially Dr. Abhishek, Dr. Anu, and so many staff. They were very cooperative with me. I cannot forget them, really. I used to walk with stick even then. So I wish all the best. Very best. Thank you very much.
Hi, I'm Sunil Sridharan, and my father, Mr. R. Sridharan, he was having in fact the knee problem for the last 10 years, and Dr. Anup happens to be a very good close family friend, and we've been known to each other right from our childhood days, so he's been suggesting me for a very long time that father should go for a knee replacement. But we were a little concerned because of the age, but then matters became so bad that we were wondering, like, at the age of 92, and will he be able to cope up with this particular knee, or will it be of any use or no? So, but then Dr. Anup was very confident that it will be fine, and moreover father was also, he was very cooperative in this. Finally, we decided to bring him here, and Dr. Abhishek Mishra happens to be very well known to me also, and somehow I had confidence in Dr. Abhishek Mishra also. And so one fine day we flew from Andamans and reached here in Delhi, and an initial investigation was done on father, and they were prepared. They said he seems to be, health point of view, all monitoring was done and they were all fine. And one of the most remarkable thing about the whole thing was, he, on his own, he goes to the washroom, he does his big job and the small job, all the jobs are being done by him. He does his own shaving, goes to the washroom, in the wash basin, he does all the morning chores, so it's not at all a problem. And then getting up from the bed and then walking all the way to washroom was never a problem after this. And he seems to be very happy, and also as per Dr. Anup and Dr. Abhishek Mishra, he should be fine, maybe a matter of a month and a half, that's probably 6 weeks from now. And tomorrow we are flying back to Andamans with the hope that 1 month down the line he should be walking without the stick. But we do have a regime of physiotherapy, so we should be following that very strictly for the next 1 week. And at the same time we'll be conveying the progress of the physiotherapy and his father's general condition. And we just hope that all goes fine. And we do have confidence in this hospital as well as Dr. Anup Raj and Dr. Abhishek Mishra.
The sole purpose of this video is to dispel one of the several myths which surround these procedures, these surgeries like total knee replacement and total hip replacement. One of the biggest myths around this procedure is like if the patient is old, the patient cannot undergo surgery, which is totally wrong. We have to look at the patient in totality. Despite the age of the patient being on the high side, say more than 70, more than 80, more than 85. If the patient does not have any comorbidities, the patient does not have any other ailments, the patient can well and easily be operated and the patient will recover very nicely. So basically, I'll just give you two examples. Suppose there is a 85-year-old guy who does not have any comorbidities, no heart ailment, no chest ailment, fit and fine. And the patient is, say, just before this problem started, patient was walking normally, patient was doing everything on his own. And patient, once the pain starts, once the problem starts, and X-rays are bad and patient requires a replacement, and the patient gets replacement without much delay, without any significant deformity, I'm sure the patient is going to do very well. On the other hand, suppose there is a 60-year-old guy, 60-year-old male or female, and say patient has several comorbidities, and the patient keeps delaying his procedure for a very long time, till the time that the patient is ridden with deformities and other problems. Basically, it forms a kind of vicious cycle. You see what happens: the patient has pain, the patient is not able to walk, the patient is not able to walk, patient grows fatter, patient grows more obese, several other problems come as an accompaniment. So it's a kind of vicious cycle. We have to cut down the cycle somewhere. We have to stop the problem at a stage when it can be controlled, and other problems, other ailments which are coming as an indirect result of this problem, they do not become very massive, they do not become too much. So basically, on the other hand, you have a 60-year-old, 65-year-old and has several comorbidities and not a very good candidate for anesthesia, and the patient has been deferring his or her surgery for a very long time. The patient has developed severe deformities in both the knees. Even if you do surgery, probably the patient will not do as well as the first patient. So probably I'll meet you again, I'll see you again with another video which would tell you, which will make you aware about another facet of this surgery called total knee replacement. Thank you so much.